It's neither Medicare nor an Advantage. Quite the opposite, in fact. And you're accurate in numbers, by the way, because I want people to know, as much as we respect our colleague from Illinois in his math, the numbers he identifies of $100 billion it's costing us, this program, 100 comes from the Congressional Budget Office. We didn't make these numbers up. That's the cost savings by modifying this program that has cost us so much, deprived the overwhelming majority of our elderly the benefits that they get at their cost. So I appreciate very much his question.
I ask my friend, is it also true that the June MedPAC report that Medicare Advantage overpayments cost taxpayers an extra $12 billion?
That's correct. And again, that's MedPAC.
Well, that's right. That's MedPAC. And I think the point that Senator from Illinois is making is it needs to be underlined 2 or 3 or 4 times here. And you've made it too, Senator Dodd. That is, there's a huge distinction between Medicare and these private insurance plans.
Yeah. I think too many of our fellow citizens hear the word Medicare Advantage and assume that's Medicare program.
That's right. They assume that, and it's not.
It's not. You know?
It's a private plan. Now, when Medicare Advantage is overpaid, that is, these insurance companies are overpaid, and a lot of that goes back to the Part D drug bill and so forth.
Right.
Now, the question is, they're overpaid, and what do those overpayments necessarily mean better benefits for persons who signed up for those plans?
No, in fact, there's no evidence that overpayments to plans leads to better health care. That's, again, according to MedPAC.
Now, why? I think that's true, but why might that be the case? So people understand this better.
Because insurers, not seniors, or the Medicare program, determine how these overpayments are used. And
Right.
too often they're used just to line their pockets, increase their profits, and not provide the benefits for the people who are getting it.
Is it Medicare that decides what the benefits will be for those folks? That's correct.
That's great. No, it's not. It's the private carriers that decide.
It's a private insurance company that determines.
That's it. Talking about private carriers. They're the ones who set these rates. They're the ones who determine where the profits go. And that's why it's such a misnomer to call this Medicare Advantage. It's anything but Medicare or an Advantage.
Also, and it's also your point about...
Time is expired.
I'd ask for 2 additional minutes.
Is there objection?
Is it also true?
Reserving the right to object to having 2 additional amendments on our
I gave 2 to my friends already on the other side. A little while.
Well, how about 1?
You get 1. You get 2, in fact. Give my colleague, make that 2. He wants 2 additional minutes. I have no problem my colleague getting 2.
And is it also, you've said the point already, but I think it's worth repeating. It's about...
Without objection, the request is agreed to.
That most seniors, that is, who pay Part B premiums under fee-for-service, don't get any benefit.
That's correct.
Whatsoever.
None. None whatsoever. In fact, all they do get is they get higher premiums.
That's right. They higher premiums.
Higher 78%. Almost 80% are paying more for a program they never get any benefit from.
The figure I saw is $90. I guess it's a year they pay extra.
Yeah.
And get no benefit from it.
So vote for the McCain amendment, and you do exactly what Dick Durbin has suggested. You preserve Medicare Advantage, neither Medicare nor an Advantage. 78% of our elderly pay more premiums. They never get any of the benefits, and the private carriers get to pocket the difference. That's a great vote around here. That's great health care reform.
Senator from Connecticut, could we characterize this as an earmark in the Medicare program?
It is 2 ears, not even 1 ear. I'll give it 2 ears.
Senator Dodd, we remember 10 years ago when the insurance companies came to the government and said, we can do something later became Medicare Advantage. We can do it less expensively. They actually said we can do it for 5% less than the cost of Medicare. And government, unfortunately, made the agreement with them to sign up to do that. Now then what happened in the last 10 years, the insurance lobbyists came here and lobbied the Bush administration and lobbied the Congress and got bigger and bigger payments. And it really is a subsidy for the insurance companies, but you say it's not, and Senator Baucus and Senator Durbin said it's not really Medicare. It's a private insurance, a privatized form of Medicare that serves the insurance companies very well, thank you, but doesn't really serve the seniors in this country.
And I'll sit here all day waiting for someone to identify a single benefit cut under the guaranteed Medicare program under our bill. Just fight one. They're all talking about Medicare Advantage, not Medicare, and there are no guaranteed benefits cut under that, and nor can those benefits be cut. Our legislation bans and prohibits any cuts in guaranteed benefits.
Mr. President,
Majority Leader.
I have 6 unanimous consent requests for committees to meet during today's session of the Senate, approved by the majority and minority leaders, and I ask unanimous consent these requests be agreed to and that they be printed in the record.
Without objection.
Mr. President.
The Senator from Oklahoma.
One of the questions and one of the promises was if you have what you have now and you like it, you can keep it. What's happening under this bill for 11 million seniors on Medicare Advantage is not going to happen. If they like it, they're not going to be able to keep what they have. You can't deny that. That's the truth. Medicare Advantage needs to be reformed. There's no question about it. I agree with it. And as the senator alluded to the Patient's Choice Act, we actually save $160 billion into the Patient's Choice Act, but we don't diminish any of the benefits. And we do that because CMS failed to competitively bid it, because when it was written, and I understand who wrote it, when it was written, we didn't make them competitively bid it. So you could get the same savings, exactly this, actually could get more savings and not reduce benefits in any amount if you competitively bid that product. But we've decided we're not going to do that. Second point I would make with my colleagues is the vast majority of people on Medicare Advantage are on the lower bottom of the economic. They can't afford an AARP supplemental bill. They can't afford to pay an extra $150 or $200 a month. And so what most of the time happens with Medicare Advantage is we bring people up to what everybody else in Medicare gets, because most people can afford, 84% of the people in this country can afford to buy a Medicare supplemental policy, because Medicare doesn't cover everything. So your idea to try to save money, I agree with. But cutting the benefits, I don't agree with. And you're right, Senator Dodd. The basic guaranteed benefits have to be supplied in Medicare Advantage, and then the things above that, which you get with a supplemental policy and which you can afford to buy, is what these people get. And what you're taking away from the poorest of our elderly is the ability to have the same care that people who can afford to buy a supplemental policy. That's the difference. Thank you, and I do appreciate my chairman for his courtesy in yielding.
The Senate has started debate on the health care bill. Majority Leader Harry Reid has warned senators to expect evening and weekend sessions. See it all live here on C-SPAN 2, the only network with the full debate unedited and commercial-free. And to read the Senate bill and the House version, and to watch video on demand, go to C-SPAN's Healthcare Hub.